Good day, this is Princess Sheila Jane Lidl-Hero, a first-year nursing student from Davao Doctors College. Today I am going to perform a return demonstration for a complete bed bath. Complete bed bath performed to physically wash or clean the dirt and microorganisms from the skin of critically ill patients or reduce infection risk. Prior to the conduct of the procedure, I have performed hand washing to protect my patient and myself as well from infection and cross-contamination. I have closed the door, fixed the curtains, adjusted room temperature, and provided adequate lighting to ensure comfort and secure patient's privacy. Next, I have prepared the necessary equipment needed. These are a basin of warm water, liquid soap, washcloth, back blanket, bath towels, moisturizing lotion, deodorant, working gloves, and a hair comb. Before I start the assessment, I will greet the client politely, introduce myself, verify the client's identity using two identifiers, which is done to make sure that I am doing the right procedure for the right patient, and of course explain the procedure that I'm about to do. Hello ma'am, I'm Princess Sheila Jane Lidl-Hero, your student nurse for today. So just for verification, may I know your complete name and your birthday please?
Shella, my name is Shella Dilahero. I was born on December 23, 1981.
Okay, thank you ma'am. Sheila, and today I'll be doing a bed bath, which means that I'm going to wash your body and remove the dirt and oils or perspirations in your skin, and of course for you to feel refreshed. Will that be alright? Yes. Okay. So I'll begin now. Would you like to void this time? Alright. Now I'm going to get my gloves done. In a hospital setting, naturally I'll have to raise the bed to a comfortable working height and lower the side rails at my side. Now, assist the patient to move closer towards me. Ma'am, I'll need you to move a little closer. Here, okay, thank you. And now, put a back blanket over the patient. Now remove the top sheet that is below the back blanket and put the linens to the laundry hamper. Now remove the patient's gown, and if the patient has injuries or reduces mobility at one side, then I shall start at the unaffected side. Give me your hand, ma'am. Please slide your gown up. After removing the patient's gown, now we have warm water, 2/3 full. It is about 43 to 46 degrees Celsius. And let the patient check the temperature if it is tolerable to them. Okay, now ma'am, I want you to check the water temperature. Is it okay? Now, remove the pillow and place the bath towel under the patient's head and over her chest. Now ask the patient if she wears contact lenses. Ma'am, do you wear contact lenses? Okay, thank you. So I'll start with washing your eyes. Now, dip the cloth in the water and fold it to create a bath mitten. Start from the inner canthus to the outer canthus. Now let's proceed to wash the forehead, cheeks, nose, ears, and neck. Ma'am, do you like soap to be used to on your face? Okay, thank you. So starting from the forehead, through the cheeks, and the nose, the ears, and lastly the neck. patient is unconscious, wash the eye with warm water only, starting from the inner canthus to the outer canthus, using a separate section of the cloth for each eye. Now use eye drops if it's prescribed. If the patient has no blinking reflex, leave the eyelids closed and place an eye patch gently. Now let's proceed washing the arms and hands and place towel beneath the patient's arms. So ma'am, I'm going to put the towel under your arms. Using firm strokes, start from the wrist to shoulder, including the axillary area. Now raise the patient's arms and support the patient's wrist and elbow. Okay, ma'am, now I will raise your arm. Now apply deodorant if needed. Now wash and clean the other side of the arm. Thank you, sir. to the chest. Place a bath towel over her chest while I lower down the back blanket, just above the umbilicus. Using a bath net, start cleaning the patient's chest and special attention to the skin folds because these areas are very prone to sweating or perspiration, also known as the bacteria. If the patient is female, special attention to the skin beneath the patient's breast. Then check and change the water as necessary. Now let's proceed to the abdomen. Place the back blanket downward to her pubic region. Start washing the patient's abdomen and also pay attention to the umbilicus and surrounding skin fold. Now let's proceed to the legs. In order for me to wash the legs, the first thing to do is to expose her legs by folding the back blanket to the midline and then place the back towel beneath her legs. Using a long, firm stroke, I'm going to wash the legs starting from the ankle to the knee and from the knee to the leg. Check for any skin redness, swelling, bruises, or pain. Also, special attention to the toes and toenails. Now, soaking the patient's feet in warm water for 10 minutes will help maintain cleanliness and feet and toenails. But we should remember to not soak their feet if the patient is diabetic because this might actually cause harm or injury. Change the water and apply a clean pair of gloves. Now do the other side of the legs. Discard washcloth and maintain patient privacy. Then refill the basin with clean water. Change clean pair of gloves and apply perineal care as necessary. So now I'm going to turn my patient into a prone position. Okay, ma'am, I need you to lie facing on your left. And place the bath towel at the side of her back and start cleaning the patient's back, buttocks, and paying special attention to the patient's skin folds. If the patient's skin is intact, remove and discard gloves used. Now ask the patient if she wants to have a massage. So ma'am, do you want to have a massage? Okay. If not, put a moisturizing lotion at the patient's back. Okay, ma'am, you can roll back now. Now put on the patient's clean gown. Okay, ma'am, so here's your new clean gown. And slide in here. Now help the patient comb her hair. Okay, ma'am, how are you feeling right now?
I feel refreshed.
Okay, that's good. So since we're done, I'm going to head out now and let you have some rest. If you need anything, don't hesitate to call me using this call right here, and I will come back to attend your needs. All right, have a nice rest. Then I'm going to clean the table to maintain cleanliness. Then after that, I will perform hand hygiene and document the procedure that I have just done. Thank you.